Many of us will remember the time we got our BCG jabs. Remember how the health ministry vans rolled into our schools? We were all rounded up and injected. There was little fuss, hardly any discussion, and that was that. It was necessary and done to protect us and others around us. Well, something like that will be playing out soon as the race to roll out a COVID-19 vaccination program unfolds in the months to come. First, we should step back and recognize what a tremendous feat this has been, because most vaccines take years or even decades to develop. So it's a tremendous feat to have several vaccines emerging from labs and trials within a year. It's at warp speed and at high levels of efficacy too, about 90%. Most of the experts would have been pleased with a vaccine that was 50 or 60% effective. Now, two of the vaccines, by Pfizer and Moderna, are called vaccines of the future because they use fairly new methods that have never been deployed before, the so-called messenger RNA. Now, this trains our bodies to produce the spike protein that causes COVID-19, and that triggers a response from our immune systems. This is a big medical breakthrough. It will help us develop new ways of combating diseases. So that's wonderful and something to cheer about in these bleak times. And all of this is nothing less than a triumph of science, of human ingenuity and sheer will. But even as we celebrate, it's probably best to hold off on the champagne and stay sober, because there are many more steps along the way in the battle against COVID-19. The testing and the data analysis is far from fully complete. While the vaccines appear to check the virus, it is still not so clear if they will stop someone who is ill from spreading it without even knowing it. Then there are the challenges of production and logistics. How to make enough of the stuff at scale and do so safely. How to get it to people all around the world at extremely low temperatures, which will require a new cold supply chain. This will take a massive effort. There are also difficult public policy questions. Who should get the vaccine first and why? Will getting a jab be a choice or a responsibility? After all, we have to protect not only ourselves, but others around us. Who will organize the delivery of the vaccines? Governments, the WHO, companies, or community groups? And who will bear the cost? These are all difficult issues which we look at in this week's Insight Special in the Straits Times. So there's much to think about and discuss in the weeks and months to come. Now, the scientists have done their part in a truly heroic effort. Now we will have to do ours. There's still much we will need to do together if we are to defeat this deadly and dastardly enemy that has hit and continues to afflict so many all around the world.